Well, October is Breast Cancer Awareness Month, and in honor of it, UC Davis Health is expanding access to free mammograms. This morning, I'm joined by Marissa Bashore with the UC Davis Cancer Center, and you've actually organized this month-long program to try to reach out to people who, for whatever reason, often financial, might not have gotten a screening.
Yeah, that's right. So we're very happy once again this year to be able to offer free mammogram appointments to folks who are uninsured or underinsured. Maybe they can't afford that cost-sharing piece under their coverage to come and get a mammogram during Breast Cancer Awareness Month.
I know you've already had a couple of days where you've had the women coming in. What was the response like for the first couple of days?
It's been wonderful. Yeah, we're always very happy.
Probably pretty busy, I'm guessing.
Yes, yeah, it has been very busy, but I'm very happy to share we still have a ton of appointments available this coming Saturday and Sunday, and we're very eager to fill those.
So age 40 is still, or currently, the recommended age to get screened unless you have a family history?
Yeah, that's correct. So especially for our program, we're calling for folks who are 40 to 74 years old, and they are asymptomatic. They're not experiencing any breast pain, lumps, swelling, discharge, and they are 40 to 74 years old. They have not had a mammogram in the last 12 months. They're welcome to call and book an appointment.
And so do people get the results of the mammogram? Is it like an on-the-spot kind of thing? Do you get, how long, for people who aren't familiar, like how long does it take to find out kind of what is seen or not seen on
That's
them?
a great question. Within a couple of weeks, everybody will receive a letter in the mail, but the key is that we've partnered with WellSpace Health, and they are our partners in this program to reach out to everybody who gets one of these screening mammograms, whether you need continued testing or not, and determine, do you have other healthcare needs? And if you need those continued imaging for your breast cancer screening, they're going to help take care and organize that for you.
You know, with the stat being 1 in 8 women will at some point in their lives get a breast cancer diagnosis. I mean, that's a sobering statistic.
It is, yeah. Unfortunately, breast cancer is still very prevalent in our communities, but early detection is key, and screening for cancer is our great tool at being able to detect cancer early.
And there are a lot of great success stories of people who found out on a normal screening that there was still something going on, and because you get that early intervention, good health often is the result that comes out of that.
Yeah, absolutely, and that's why these screening tests are designed for when you're feeling great otherwise, because often cancer doesn't show any signs or symptoms when it's first developing, including for breast cancer. And so these screenings are designed to catch cancer very early on when you're typically going to have the most treatment options, and they're going to be, you know, the most successful.
Okay, so for people who are interested, the easiest way to get in on one of these available screenings is?
Yes, please call and book an appointment, 916-734-8449. Call. We have appointments again, lots of appointments available this Saturday and Sunday for folks who are uninsured or underinsured, ages 40 to 74, and have not had a mammogram in the last 12 months.
Perfect. And we'll put all of this on kcra.com and on our app as well. Thank you very much. And I have a feeling you'll be very busy, which is a good thing.